With crime-related matters, abuse of women and girls is rife in South Africa. But what's the reason behind it? Well, the Violence Against Women and Girls global program has sought to understand and address the underlying causes. The results have been groundbreaking. One of the programs has shown that there's been a decrease of 40% in violent actions by men in informal settlements in South Africa. Well, What Works Program Director at the SA Medical Research Council, Professor Rachel Jukes, joins us now on the line. Prof, good morning to you. Firstly, talk to us about what the underlying causes of gender-based violence are in this country.
Good morning. Well, there are several causes. I think that the most important underlying cause is patriarchy. It's the incredibly unequal gender relations we have in our country that result in men feeling entitled to dominate and control women and sexually entitled towards women, which is one of the drivers of rape. But also linked to that is the incredibly common use of violence in interpersonal relationships, and when people want to try and prove a point or show that they're dominant or punish other people, then whether it's parents hitting children or teachers hitting children or people fighting in the community, we see the use of violence. And violence within our intimate relationships between husbands and wives, girlfriends and, well, boyfriends and girlfriends is very much part of the overall pattern of violence. So the key question is, why are we a society that is so patriarchal and has such widespread use of violence? And the answers there lie in the fact that we have a phenomenal problem of poverty and unemployment, which is a key driver of violence and gender inequality. We have a history of trauma, and a lot of the people in South Africa have been traumatized as children. They've been subjected to violence and abuse in childhood, which impacts on their interpersonal relationships and the way they behave throughout their lives. And we have huge problems with poor mental health stemming from that, and substance abuse. So these are all interconnected and drive our problems of violence.
Prof, you then talk about in your research about some groundbreaking discoveries, one of which is this 40% decline in violent action, particularly in informal settlements.
Well, this was a study where we were evaluating an intervention called Stepping Stones Creating Futures in informal settlements, and it combined a livelihood strengthening interventions, Creating Futures, that essentially tried to strengthen the livelihoods and reduce the poverty of men within the programme and women within the programme, and combined that with a gender transformative intervention, bringing them to the table to start thinking through gender relations, challenging the normative use of violence. And it was this intervention that we've tested in informal settlements, particularly around Durban, which we've seen these great results from.
And what exactly, how was it conducted? It's quite interesting that you targeted Durban, or you conducted this research in Durban. How did it unfold, this whole process?
Well, we were working with a local NGO called Project Empower, and the research was being done by the South African Medical Research Council. And Project Empower has a footprint of working in informal settlements around eThekwini, and so we use their long track record of experience to as a way of getting entry into these areas, and we co-developed and tested these interventions, particularly the Creating Futures side, because the real challenge is to say, what is it that we can do with relatively limited resources to try and alleviate poverty within these areas, because if you're working in a situation where poverty is a key driver of violence, you actually can't really engage without addressing both poverty as a driver and the patriarchal gender relations and acceptability of use of violence as a sort of co-driver within that setting. So that's what the intervention did. We took men and women together. We worked in single-sex groups of about 20 people, and we took them through a programme of 20 sessions on gender and communication skills building, critical reflection and participatory programme. And then they had 21 sessions of the Creating Futures intervention, where we were taking them through different skills building around with the goal of enabling them to strengthen their livelihoods.
Thank you very much, Professor, for those insights. She's a director at the SA Medical Research Council.